So Steve, we're obviously aware of the plans for the Huddersfield HRI. What I wanted to know is what's your opinion on what's been going on over the last few months?
I mean, first of all, we're not closing the A&E as such. We're redesigning urgent care and emergency care for our healthcare system. So I know people think that there's a hospital closing, but if they read our proposals, they'll see that we're actually intending to build a brand new hospital in Huddersfield. And in that hospital there will be an urgent care centre, and we think that urgent care centre will deal with over 50% of the things that currently go to the A&E department as it is. But if patients are properly poorly, then they will have to travel in our proposals over to Calderdale, where they will be seen in the emergency centre. So this is a total change in what we're currently providing.
But a drive over to Calderdale is going to be a bit longer than just popping over to the Huddersfield HRI. I mean, what's your view on that?
I do understand people's concern about the extra distance that they will have to travel if they are more severely ill. We have involved the ambulance service in our discussions so far, and we know that the increased travel times on average will be about 7 minutes. But if you're in a blue light ambulance, which is what you'll be in if you're going to the emergency centre, then you'll be travelling further, but when you get there you'll get a far superior service than what you've got now. We're intending to have specialists available 24 hours a day, so your treatment can start earlier, and we think that people will get a better experience from this setup.
What happens if, worst case scenario, an ambulance can't get there?
Ambulances have to travel through many difficult situations all the time. We know that traffic jams happen, but throughout West Yorkshire, ambulances have to get through Leeds city centre, they've got to get around the Bradford Ring Road, and yes, they have to get along the Ellen bypass when it's snarled up. But we're confident that ambulances can get through, and with their blue lights on, so we do not think we're putting extra risk in the system by doing this.
There's a rather eye-catching phrase that came out earlier, which was right care, right time and right place. But there are going to be people out there who might not necessarily agree with that. I mean, right care, the Huddersfield one's closing down, and right place, I mean, Calderdale's not exactly Huddersfield. So I was wondering if you could elaborate on that a little bit for me.
Right care, right time, right place is all about the care that people receive, and at the moment we have a split hospital site that's trying to do everything on both sites, and we know that we can provide the right care at the right time by centralising onto one site. Our population in Greater Huddersfield and Calderdale only needs one emergency centre, and that will provide better care than what they get at the moment. And so while people may not think that Calderdale is the right place, when they in our proposals, the care that they will get there will be far superior than what they get at the moment, and that's where we've got the logo from. We're in public consultation at the moment to get the public to look at our proposals, and we're not sitting here saying, look, this is absolutely perfect. We want to hear their views, and we will take all those views into consideration, because we will have to make changes even to our proposals now. So I think what we eventually implement in 3 to 5 years' time may not be exactly what we have on the table now.